Welcome to my presentation on the Community Health Assessment conducted by Christine Williams. The community being assessed is Goldsboro, located in Wayne County, North Carolina. According to Census Reporter 2023, the population is 33,448. And the demographics include 53.1% African American, 34.3% white, 5.53% Hispanic, 1.78% Asian, the median age is 36.7, and the poverty rate is 20.8%, according to Data USA 2023. The North Carolina Department of Health and Human Services 2025 states that the infant mortality rate is 6.9% in 2023. The most recent Community Health Needs Assessment for Wayne County, North Carolina was conducted in 2024. Their top 3 priorities are mental health, diabetes and obesity, maternal and infant health. For mental health, they've noted lack of mental health services and treatment facilities. They've noticed a high prevalence of diabetes and obesity in the community and high rates of low or no prenatal care. So when the county does their data collection, they gather quantitative data as well as qualitative data. So for quantitative data, they're looking at public health databases like the North Carolina Department of Health, the CDC. They're looking at local hospital records, mortality rates, disease prevalence, and they're also looking at demographics and social determinants like income, education, and housing. For their qualitative data, they send out surveys to community members. They do focus groups, which is a small group of residents that's chosen to represent different demographics. And they also have key informant interviews, which are one-on-one interviews with community leaders, healthcare providers, teachers, and those are all people who understand local needs. One of the top priorities that the Community Health Needs Assessment has shown is mental health. And during the focus group, they found that mental health is identified as a major community concern, and there's a severe shortage of mental health services and treatment facilities in Wayne County. There's also a stigma around mental health, which limits people from seeking help themselves. And some common concerns are depression, anxiety, substance abuse, and homelessness. Vulnerable populations are most affected by limited access to care. The second priority is diabetes and obesity. I've added a table here from the Wayne County Health Department that shows adults age 20 plus with diagnosed diabetes is 10.7% in Wayne County. In North Carolina is 9%. In the United States is 8.9%. So we're showing higher than North Carolina in general and the overall in the United States. And also the second star here, adults with BMI over 30, which is considered obese. We have 34.8% obese in the county. North Carolina is 29.7, and in the United States is 30.1. So again, we're above average in these areas. The focus group findings show that there's barriers to healthy living. We have limited access to affordable, healthy foods. There's few safe places for physical activity, and there's also transportation challenges. So they found a need for improved health education and chronic disease management. Priority number 3 for the Community Health Needs Assessment was maternal and infant health. And we can see highlighted in red in this top chart here is the percentage of low birth weight, which is 9.9%, and that's above average in North Carolina. And I also added the percent of insured population receiving Medicaid is 29%. In North Carolina is 20%. In the United States is 22%. So we're seeing an increase in poverty in those that need assistance. The focus group findings for maternal and infant health include disparities in maternal and infant care and access and outcomes. So possibly limited access to specialized OB care. There's also challenges with access to prenatal care and support for new mothers. There's a need for maternal mental health support and culturally competent care. We do have a culturally diverse population, and everyone has different ideals on how to go about being a new mother. So we need to make sure our medical facilities are taking that into account. We also need resources for women and children in crisis, so shelters for domestic violence victims and homelessness. The school breakdown in Goldsboro, there's 84 preschools, 31 elementary schools, 19 middle schools, and 15 high schools. And here is a picture of Small World, which is a daycare located in Goldsboro, and then Meadow Lane. Most of my windshield assessment was conducted on Ash Street in Goldsboro. It's considered downtown Goldsboro, so I felt like that was the best option as far as showing what Goldsboro is like. As far as housing, we have all types of housing. We have townhomes, we have new builds, we have single-family homes, we have subsidized housing. According to Data USA, the median property value in 2023 in Goldsboro was $173,700, but the national average is $303,400. Community vitality, businesses, and shopping centers. So there are numerous businesses and shopping centers in downtown Goldsboro. There's a lot of retail options. There's also presence of essential services like groceries and banks. It is accessible with US Highway 70 within 1 mile for access to regional shopping. And the overall impression I got going through town is it shows a moderate to high economic activity. It's fairly busy, and most businesses appear well maintained. Indicators of health resources. So in town, there's a limited number of primary care facilities. Most residents are going to have to travel about 5 miles for general medical services, which is near the hospital and has a compound of numerous medical services. There are a few specialist and wellness options that are closer into town. There's some chiropractors, there's a CrossFit, there's Planet Fitness, and other health-focused facilities in town. Again, the hospital is about 5 miles, so it wouldn't be within walking distance if you live in downtown Goldsboro. My overall impression is that health resources are available but do require transportation, which could hinder a lot of people's ability to get health care. Indicators of health resources continued. There are a lot of local and commercial options for pharmacies, and the health department was located on Ash Street, where I had conducted this windshield survey mostly, but it has relocated 1.5 miles from the previous location on Ash Street. So not a huge difference. And it's a newer building and it has more resources than they had previously at their old location. Environmental conditions. The road conditions are mediocre. It is a fairly old town. There are some large potholes in the area that have been there for years that have not been fixed yet. Trash management, there noted a few overflowing dumpsters in the area. Animal control, stray cat. I did notice a stray cat while I was out doing the windshield survey, but the animal shelter is about 1.5 miles from Ash Street. Recreational spaces, there were sidewalks present. There's a skate park here shown in the bottom left-hand corner, and there was a nearby green areas and a park over there as well. Some do have safety concerns about that area, so it may not get used as much as it should. But other observations, there was no standing water. Lighting and noise levels were typical of a small downtown location, and bus stops were well maintained. Cultural resources. There are international food options available. There are locally owned grocery stores and restaurants that offer diverse food options. Like here in this bottom corner is BritFix, where you can get all the British food needs, which is great for an area like Seymour Johnson, where another big base associated with it is in England. So there are a lot of people from that area that come to Goldsboro. So that's good for them. And then there's also an Asian Alliance International Market. So it's all sorts of Asian food and not specific to like one culture. I did not notice any signs in front of businesses that had multiple languages on them. So I would say that we need to increase our signage in multiple languages. Cultural resources continued. We do have higher education. We have Wayne Community College, which is also located about 5 miles from Ash Street, right next to the hospital and the medical complex out there. We do have a library that provides language learning classes, books, newspapers, genealogy tools, DVDs, and online access for those who need it. My PSA topic would be in behavioral health, since it is a top 2024 community health needs assessment priority. Some community factors are poverty, homelessness, the crime impact outcomes. There's observed gaps in social support and services, so there's limited access to mental health clinics, counselors. There's very few substance abuse treatment programs. There's insufficient amount of shelters and housing resources for homeless individuals. And we do have scarce recreational and community programs that reduce stress and promote well-being. And this is my references page. Thank you.